A tip to health services that can make partnering easier for consumers, I think regarding consumers very much as part of the team, the clinical team. Seek out and welcome consumer feedback. It's valuable information and it'll enable clinicians to provide better, individualised care if patients are considered to be part of that team. We also need to create an environment that encourages consumers to question, and I think that will give them the knowledge and confidence to take a more active role in their own healthcare.
Well, I think health services need to make opportunities available so that they can listen to consumers, because we have the sort of pointy end experience. And yes, it is about listening, because you can, if you tick the box for participation but don't actually use that wisely, it's not going to work.
I think my one tip for health services when they're looking at partnering and what's going to maximise the impact and the effectiveness of that engagement is being genuine. Consumers want to know that what they have to say and their experiences are really going to be listened to, and that how people receive health services in the future are going to be improved. They know this by when they feel listened to and when they see action as a result of their feedback.
Tips around engaging Aboriginal and Torres Strait Islander consumers is really about knowing what networks are already in place, what governance structures are already in place with some of these community-controlled organisations. It's about tapping into those. There's this expectation that Aboriginal and Torres Strait Islander people are always to come within and fit within a Western system and to be able to be engaged in that. It's really important that we are actually engaging in Aboriginal and Torres Strait Islander community-controlled areas, because that is the safest place in which Aboriginal and Torres Strait Islander people will feel comfortable in having their voices heard.
It's got to come from the top down, and I think the message is coming from the top down, that clinicians are to engage consumers and in a meaningful way, not just by ticking a box and saying, yes, I've spoken to a consumer, but to actually act on it and to question the way they're doing things and perhaps redesigning their service around what the consumer has suggested.
I think the one thing for health professionals to consider in terms of getting the best out of their consumers and how they best use us, is to actually work out and learn what makes us tick, understand that we don't all fit in the one box. We might not all sit in a steering committee box and in a meeting room box. However, our unique perspective and our view on life and our patient experience, consumer experience is really valid, and it's finding a way to make use of that information to improve health.
For health services to effectively partner with consumers, it's really important that the leaders who run the services and the people delivering the services engage directly with consumers and consumer representatives. I think it's really important that consumers have representation and networks to inform their position. I've found it really ineffective when consumers are trying to engage with a service through consumer liaison staff and that sort of thing. It's about directly connecting the consumer perspective with the people who are delivering the services and who've got the power to make decisions about the services.